Tim?
Yes, I'm here.
Oh, great. Is Maria on with us already?
She is. Yep.
Okay, perfect. So we should just start at 2.
Okay. All right. Give me just one moment. All right. Well, thank you all for joining us today for today's media briefing with the Department of Public Health and the Los Angeles County Office of Education. Today we have with us Dr. Maria Martinez-Pullen, the Deputy Superintendent for LACO, and we have with us the Director of Public Health, Dr. Barbara Ferrer. They'll make remarks, and that'll be followed by taking questions from you guys. And if you have a question, please click on the hand icon, which is in the participant panel, or you can send me a message or a chat, and I will add you to the queue. And then we will make remarks in Spanish beginning at 3 o'clock. So first, I'd like to recognize Dr. Maria Martinez-Pullen, Deputy Superintendent of Los Angeles County Office of Education. Please go ahead.
Thank you. Good afternoon, everyone, and special thanks to our friends in the news media for continuing to provide us an opportunity to connect with the community. I want to take a moment to thank Dr. Ferrer and the Department of Public Health for their collaboration. They have been committed to listening to our feedback, sharing information, and making data-driven decisions. Thank you for listening. The return to in-person instruction this fall has not been without challenges in education. But in education, we talk a lot about a growth mindset, and in this moment, we are called to model it for our students. A growth mindset embraces challenges and the process of getting better. We know that educators across the Los Angeles County are meeting this moment with grit, perseverance, and a commitment to continuous improvement. I'd like to take a few minutes today to share with parents some of the different tools that districts across the county are using to put in place to provide multiple layers of protection for students attending class in person. For school opening plans, they provide daily symptom checks, regular testing for COVID, staggered schedules to limit gatherings and opportunities for exposures, quarantine and isolation to prevent the spread of COVID, require masks, face shields, and they make sure that all of our students have a mask at school should they forget it on the bus or en route to the school as well. We also require the mask indoors and strongly recommend outdoors when social distancing isn't possible. At lunch, there are staggered schedules and cohorts outdoors if possible. We achieve as much social distancing as possible. With COVID testing in our schools, districts continue to implement and expand their testing programs. There is federal funding from the CDC available to support testing programs at our school districts. Parents can connect with school principals to learn more about opportunities for their children to participate in regular testing at school. These screening programs are critical to quickly detect and identify cases within school communities. We are grateful to our school communities across the county for their tireless commitment to the health and safety of students. I have had the opportunity to visit schools throughout the county as they welcome students to school campuses this fall. Students are excited to be back in person and, most importantly, connecting with each other, which is essential to their mental health. Know that teachers, classified staff, certificated staff, principals, everyone is working and they care deeply about your children and to provide a safe environment so that they can continue to stay in in-person instruction as much as possible. I now turn it over to Dr. Ferrer.
Yeah, good afternoon. Thank you so much, everyone, for joining us today. And I'm so grateful to Dr. Martinez-Pullen and Dr. Eduardo and the entire LACO team for their exceptional leadership during these most challenging times and for the opportunity to work in close partnership with all the districts to ensure safety at all of our schools. This afternoon, I'll be presenting information on trends in pediatric cases and hospitalizations, data on cases, outbreaks, and investigations at schools, and information on school quarantine guidance changes. And we could start with the first slide. I'll start with this trend line, which shows the trends in COVID-19 case rates by pediatric age group from the beginning of the pandemic all the way till now. This trend line shows 7-day cumulative case rates in 3 different age groups. And as you can see, our case rates never rose as high as they did during the winter surge, during this last summer surge that we've just experienced. And while case rates did rise among children in all age groups between mid-July and mid-August, they have since declined in all age groups. The current case rates for 12 to 17-year-olds is 132 new cases per 100,000 teens. For 5 to 11-year-olds, the case rate is now 141 new cases per 100,000 children. And for children 0 to 4, the case rate is 88 new cases per 100,000. And I want to note that this mirrors declines that we're seeing in our adult population. Case rates in 12 to 17-year-olds, here represented by the blue line, continue to track with cases in children 5 to 11, which is represented by the orange line. And as you can see, cases among the youngest children remain lower. Over the last 3 weeks, cases declined across all age groups by about 40%. With most of the 1.5 million children in grades K to 12 now having returned to in-person instruction, we're encouraged that the case rates did not increase. Next slide. Hospitalizations are also, of course, reflecting the declines in cases. This graph shows our hospitalization rates among children ages 0 to 4, that's represented by the green line, children aged 5 to 11, represented by the orange line, and those 12 to 17, represented again by the blue line. And while our pediatric hospitalization rates remain higher now than they were in the spring and early summer, they are starting to decline, and they never approach the high rates we saw during our winter surge. If our case rates don't increase, we do anticipate a stabilization or even small declines among pediatric hospitalizations. And although the data is not shown on this chart, we have had no additional pediatric deaths. Our prayers do remain with the families and friends of the 7 children who did lose their lives to COVID. Next slide. We're also able to track the trends for cases by pediatric age group and for those 12 to 17 years old by vaccination status. Among children in this oldest age group, where some are vaccinated and some are not, the effectiveness of the vaccines is easily apparent. The blue dotted line, which represents the case rate among unvaccinated 12 to 17-year-olds, rises far above the rates of children in this age group who are fully vaccinated. That's the blue line you see at the very bottom of the table. And of those that are fully vaccinated, you can see that their rates are lower than in any other age group. You can also see that after increases across all of the groups, as we noted before, case rates decreased by about, I think it's almost 43% across all the age groups. And this is promising since it's occurring as students are going back to school. So we're hopeful with continued close attention to those school-based strategies that reduce the risk of exposure, we'll continue to see these lower case rates across all age groups. Next slide. With the heightened awareness of vaccine effectiveness, our highest priority is to increase vaccination rates among those eligible teens yet unvaccinated. As of September 12th, 63% of LA County teens 12 to 15 years old had received at least 1 dose of vaccine, and 53% are fully vaccinated. Among teens 16 to 17 years old, 70% received at least 1 dose, and 61% in this age group are fully vaccinated. Safety at schools is clearly amplified manyfold when vaccination coverage is very high, and widespread vaccinations would dramatically reduce transmission in other settings, including at after-school activities, community events, and at home. We are grateful to all that are doing their part to get these vaccination coverage numbers up. To the teens who are getting vaccinated and their parents, the vaccination clinics that welcome families at times and in places that are convenient, and the leadership at school districts requiring vaccinations for those eligible. Next slide. We're also working closely with schools to follow the number of positive cases and their close contacts, as seen on this busy table. These numbers reflect the total number of new cases and close contacts reported from K-12 school settings countywide between August 15th and September 13th. In addition to reporting the number of cases and contacts by their status as either a student or a staff, we're also reporting where we have the information for each category, those that are fully vaccinated. You may note that some of these numbers are slightly different from last week's. These changes are due to a switch in analyzing this case data by episode date rather than report date, which means we're now excluding cases that were identified prior to August 15th. The data presented here provide a more accurate picture of new cases over this time period. Looking at the columns under the heading of cases, you can see that we've had a total of almost 8,000 student cases and just about 1,200 staff cases reported during what is really a 3-week period. The majority in both groups are accounted for by LAUSD, which tests everyone weekly. With more than 1.5 million students and 175,000 staff countywide, this is using last year's counts, it means that 0.5% of our student body and 0.7% of our staff have become infected since school districts opened. This is just slightly higher than the 0.4% rate of infection we experience overall in the county. And given the massive testing of asymptomatic individuals at schools, this very low rate of infection affirms the safety that's provided to students and staff on their campuses. When we look at the close contacts who, if they're not fully vaccinated, are subject to quarantine for up to 10 days after exposure to a case, you'll note that there are about almost 16,000 student contacts, slightly over 1,000 staff contacts that have been reported, with an additional 22,650 close contacts of unknown status. Most of them we suspect are students. In total, nearly 2% of all staff and students countywide have been identified as a close contact of a case. Data to date indicates that very few of the identified close contacts have subsequently tested positive. As of last week, among the almost 30,000 people that ended up quarantined, 63 tested positive. This amounts to what we call a secondary attack rate of 0.2%, extraordinarily low. There are effective strategies that can reduce the numbers of students and staff needing to quarantine after exposure to a case, and we provide assistance to schools with large numbers of cases and close contacts. We have a call center that's staffed every day during the week where any administrators from schools, both public and private, can call and get immediate assistance with the management of cases and the identification of those close contacts. Our staff are also sent to schools needing help, and when an outbreak is identified, a DPH team provides additional support to make sure we're doing our best to limit continued transmission. I do want to note that the most effective strategy for reducing quarantine disruptions in middle and high schools is to have all eligible students and staff fully vaccinated as soon as possible. We can go on to the next slide. We can also look at information about cases by the number of school programs that are reporting 1, 2, or 3 or more cases, and track how this has changed each week since schools opened. Note that we're now reporting on case date. We're reporting this case data by episode date rather than report date. Again, we want to control for making sure we're just accounting for those cases identified during this time period. Since August 16th, 1,957 schools have reported at least one case to the Department of Public Health. As you can see in this table, school programs reporting one case increased initially from 467 schools during the first week of schools reopening to 562 during the second week, but reports of single cases have declined over the most recent 2 weeks of monitoring. Sites reporting 2 cases remained at a similar level for the first 3 weeks of school, but again, we observed a decline on this as well last week. Sites reporting 3 or more cases have been declining since the first week of school. there's been a 43% decrease in the number of schools reporting 3 or more cases between the most recent 2 weeks of monitoring. Every case that's identified at a school needs to isolate at home away from others for a minimum of 10 days from their symptom onset or their test date. Their close contacts are identified, and if they're unvaccinated, they are required to quarantine. Next slide. While cases among students and staff are decreasing, most of our cases in school settings are among people who are not fully vaccinated, although the proportion of cases among people who are fully vaccinated, as you can see on this table, increases with the age of those infected. Between August 15th and September 14th, 5% of cases among teens 12 to 14 years of age were among teens that were fully vaccinated, and 11% of cases among teens 15 to 18 were among those fully vaccinated in this age group. Meanwhile, 22 to 24% of cases aged 19 to 39 were fully vaccinated people, and 35% of cases among staff 60 and over were fully vaccinated. The higher percent of cases among fully vaccinated adults is most likely due to the much higher numbers of individuals in these age groups that are vaccinated. This is particularly true because there is a vaccination mandate for school staff. Note again that because LAUSD is not reporting yet on vaccination status among its cases, the data we have here are all from the non-LAUSD districts. Next slide. We continue to track outbreaks at LA County schools and school-affiliated programs, including youth sports. An outbreak is when 3 or more cases with a probable transmission occurring at schools or school activities is noted. As I said earlier, in most instances at schools where there are more than 3 cases, the cases are not linked to each other, and therefore they don't count as an outbreak. We saw 6 outbreaks during the week of August 29th and 8 outbreaks last week. Although youth sports, represented here by the orange blocks, were the primary source of outbreaks among K-12 age children over the late summer and have remained a persistent source, most outbreaks are now taking place in elementary schools, represented here by the light blue blocks. While the small number of confirmed outbreaks is very low and a positive sign that mitigation efforts are very effective at reducing transmission, we do anticipate that we'll continue to see an upward trend in outbreaks as more schools are open. And the Department of Public Health will continue to work with all schools to prevent, investigate, and manage these outbreaks as they happen. Next slide. On this chart, you can see the number of cases and contacts that are involved in the outbreaks that I outlined on this previous slide. Note that these numbers are different from what I showed in the earlier slide, where I was looking at all the cases in K-12 and all of the contacts. Because as I noted, the numbers of cases that are actually linked as part of an outbreak is a very small subset of the total numbers of cases that get identified, mostly through testing each week. The number of outbreaks happening at schools really is unusually low. As we noted a minute ago, we went from 6 to 8 outbreaks between the week that ended August 29th to the week that ended August 5th. That's a small increase of about 33%. The number of cases that were involved in these outbreaks increased about 50% over the same time interval, and the number of contacts increased by more than 70%. This suggests schools and youth sports last week identified more close contacts for the cases than compared to the prior week. Appropriately managing these outbreaks is important so that we can avoid widespread transmission at schools. And we're grateful for all the support at the schools and for our outbreak investigators that assist with this task at every single school that has had an outbreak. Next slide. As part of the mitigation efforts at the 31 schools that did experience an outbreak, we've identified some risky practices that are often associated with outbreaks, not just at schools, but in a variety of settings. And we've listed some of those practices on this slide. Inconsistent and incorrect mask use indoors is a common feature of outbreaks. Wearing masks correctly and consistently indoors and when in close contact with others outdoors definitely helps reduce outbreak risk. Crowding outside classrooms is also linked to transmission, particularly at times when masks must come off. For example, when students are eating or drinking. And keeping people apart, physically distanced and outdoors makes transmission a lot less likely. Arranging desks and pods, while it facilitates good educational cooperation and learning, it actually facilitates transmission by placing students face to face. So facing all the desks in the same direction would reduce the transmission risk. There are a couple of outbreaks that are associated with allowing symptomatic people to come on site, making it more likely that they have a chance to spread infection. So excluding symptomatic people from schools would stop this chain of transmission. Next slide. On this slide, you see a similar list of practices that are associated with outbreaks in youth sports. Here again, inconsistent and incorrect mask use during practices and games is a common feature of youth sports outbreaks. Not excluding symptomatic people and close contacts from athletic team activities, including those off the field, is associated with many of the outbreaks we have investigated. And it really highlights the importance of including symptomatic people and close contacts to stop onward transmission. Oftentimes, students are, take a lot of time to disclose that they have bad headaches, they're feeling super tired, they have a sore throat. So it's important that there be good checking of students who are participating in athletic activities to make sure that you're not contributing to unnecessary spread. When teams are mixing in weight rooms, they're spread among and between teams. That's happened. And we recommend maintaining some cohorting in the weight rooms for different teams. So avoid having both the JV and the varsity teams in the weight room at the same time. Mixing and crowding in locker rooms is also associated with team outbreaks, and that can be avoided by staggering the use of locker rooms to avoid both crowding and to promote distancing. Next slide. After reviewing 4 weeks worth of data related to cases, close contacts, and outbreaks at school, much of which I just shared, we feel comfortable that with relatively low transmission at schools, it's appropriate to offer schools a modified quarantine option for K-12 students exposed to COVID at schools under certain circumstances. Schools and school districts are not required to offer a modified option to their students, and they may choose to continue with the customary quarantine requirements. And just as a reminder, fully vaccinated individuals that are asymptomatic are not required to quarantine. These students should monitor themselves for signs and symptoms of illness for 14 days after their last exposure. Modified quarantine, as you can see here, allows under certain specific conditions an exposed, unvaccinated student who has an exposure to a confirmed COVID-19 case to continue in-person instruction at school during their quarantine, while restricting all of their activities outside of what's necessary for their academic instruction. Those who qualify for modified quarantine include close contacts whose exposure took place at school or at a school supervised activity when both the close contact and the case were masked during the entire exposure period, and the close contacts are not part of a defined outbreak. To apply a modified quarantine, several criteria would need to be met. First, the exposed student must remain asymptomatic for the duration of the quarantine period. They must also stay home except for classroom and educational instruction activities. And they need to continue to always wear a mask indoors, outdoors, and on the school bus, except for when they're eating and drinking. While eating and drinking, these students need to maintain at least a 6-foot distance from others, and ideally, they should be eating and drinking outdoors. Students in modified quarantine must also be tested twice a week during their quarantine. We recommend the first test should happen on day 1 or 2 after exposure, while the second test should be 5 days or later after exposure. Modified quarantine can end when a second test is done at least 5 days after the exposure and that test is negative. That is the same as the rule for students who are doing a customary quarantine. They have that same option. So in this scenario, an exposed student can end modified quarantine after day 7. Last slide. We're grateful to everyone that's working so hard to ensure safety at schools for students, staff, and families. And we applaud the efforts to date that have been very successful at reducing exposures. We're mindful that the most powerful protection against spread is the vaccine, and we fully support targeted vaccination mandates. With more than one school district now mandating vaccination among children 12 and over, I wanted to close by noting the benefits of vaccinating eligible teens. Although vaccinated people can transmit the Delta variant, they likely transmit less than unvaccinated people. And as I showed you earlier, they're about 8 times less likely to get infected. So while vaccinating teens clearly protects the teens themselves, it's also important to note that it protects the friends and family members with whom they share so much of their out-of-school time. Vaccinating teens has the advantage of protecting younger children at school with whom they come in contact and who cannot be vaccinated. And because vaccinating teens also reduces transmission at school, it decreases the likelihood of outbreaks that cause disruptions in learning. One major advantage of being vaccinated is that fully vaccinated students are more likely to be able to stay in school after an exposure without a quarantine. Our quarantine guidance exempts asymptomatic, fully vaccinated individuals from needing to quarantine. Along with our school partners, we're working really hard to ensure it's easy for teens to get vaccinated. So please, if you're a teen that's not vaccinated or you're a parent of a teen and you want to find a place to go very soon and get vaccinated, go to our website, vaccinatelacounty.com. Thank you. And now Dr. Martinez-Poulin and I will take your questions.
As a reminder, if you want to be put in the queue to ask a question, please click on that hand icon, and that will enter you into the queue. Or you can send me, the host, a chat. Our first question will come from Ron Lynn with the LA Times.
Hi, doctors. Thanks so much for doing this. Really appreciate it. 3 questions for you today, Dr. Ferrer. What factors should school districts consider in whether they should use a stricter quarantine policy? And do you have any advice for school districts on whether that might be more appropriate for them? 2, regarding the vaccination mandate you announced yesterday, I wanted to confirm that whether theme parks will be included in a requirement for customers to show either proof of vaccination or a recent negative test. And then finally, are we starting to see any boost in the pace of vaccinations, either in children or in adults, as a result of various vaccination mandates? Thanks so much.
Thanks so much, Ron, for your questions. Factors that I think school districts are considering whether or not they want to go ahead and adopt a modified quarantine protocol really depends on whether or not you have the resources to actually fully implement the requirements of a modified quarantine. I mean, you have to be super careful that for sure and you're able to verify that close contacts to cases had only mask on mask exposure. And sometimes that's hard, particularly in large schools. That may be very difficult to do. Certainly, if the exposure just happened in a classroom setting and you know that everybody had their masks on in that classroom setting, that's easy. So you have an isolated exposure, students in a class, everybody kept their mask on. But it gets complicated when students are doing other activities together, particularly eating lunch or enjoying recess, where they're often outdoors and maybe taking off their masks, making it impossible for them to maintain that mask on mask exposure. So schools will need to have that resource available whereby they can do that work and in fact verify that this was a mask on mask exposure. And I also think it depends on how many cases you're seeing in your school and how many close contacts you're identifying, whether this is a sensible strategy. We have removed the option to do modified quarantines when there's an outbreak situation. Our experience to date has shown that that's when there's likely to be a fair amount of transmission. Obviously, we've already been able to establish in-school transmission in declaring an outbreak. But I think for other schools, they've indicated to us, when they have large numbers of cases that are happening, they're worried about that. And it's easiest at that point to just use a standard quarantine procedure to make sure you're not increasing risk. But I want to note the extraordinarily low rates of secondary infections that we've seen. And I want to applaud the schools and all of the people in the schools, including the students, who are highly compliant with the both masking requirements, but also every school has distancing requirements in different places and infection control requirements. And I think we only get to these numbers because there's a collective effort to try to keep schools as safe as possible. In terms of the second question, are theme parks included? Yes, the state has included theme parks in their definition of mega event venues and mega events. Again, it's only for those theme parks that have over 10,000 visitors. For parks that are smaller, they will not be covered by this. So again, it's events and venues that have more than 10,000 people. So they will be covered. And then have we seen a boost in the pace of vaccinations? We won't know that. We have a lag in when we report what we report on vaccinations. Our hope is, particularly with the vaccination requirements that our school districts are asking our teens to follow. We're hoping that teens in particular are coming in very quickly to go ahead and get those vaccinations if they're not yet vaccinated. But we'll have to look at next week's numbers at the end of the week to be able to really see what kind of boost we're getting. I mean, as you all know, because I shared numbers last week, as of a couple of weeks ago, we were not seeing that boost that we had hoped to see and that we're still hoping to see. So we have, there is time. All of the vaccination mandates allow for people to have time to get their questions answered, their concerns addressed, talk with people you trust, and then get yourselves over to a vaccination site so you can go ahead and get started. For teens, it is only a Pfizer vaccine that they can get, so it does require that they do some planning, and it will take those 5 weeks to be fully vaccinated. So thanks for that. And we can go on to the next question.
Hey, this is Ron Lynn. I think they're allowing me to ask two follow-up questions. One is, so you just mentioned that you've removed the option to do modified quarantines when there's an outbreak situation. So the first question is, does that mean that if there's an outbreak situation in which it's clear that the teacher is infecting the students or students are infecting each other, that you can't do a modified quarantine, you go back to the standard quarantine? And then the second question is does the quarantine policy apply to teachers too? Thanks.
Yeah. Both really good questions. So when we've established that there's an outbreak, then anybody who's on the close contact list will need to do, a customary quarantine. They're not allowed to do the modified quarantine. So I hope that explains that. And the state only offered the option for a modified quarantine to students. So it is not an option for staff or teachers at this point. This is an option just for students to try to make sure that they have as little disruption in their education as possible.
Great, thanks. The next question will come from Joy Benedict with CBS Los Angeles.
Awesome. Thank you so much for taking my question. I have two. The first one is, I guess, regarding the policy that's supposed to be announced tomorrow regarding the bars and all of that stuff, because the CDC has not made a recommendation regarding these so-called vaccine passports. So with so many breakthrough cases, there seems to be a lot of confusion on whether being vaccinated can actually prevent the spread of COVID. Yes, they may shed less virus, but they do still shed. So can you explain to us what research is fueling this change? Because to many, it does just kind of feel like another punishment for the unvaccinated or a trick to try and force their hand. And secondly, how is the health department going to try and enforce this new policy?
Yeah, thanks so much for both of those questions. And I think I spent a fair amount of time today showing data that actually shows that vaccinated people much less likely to get infected than unvaccinated people among children. And certainly when I show data tomorrow, you'll see the same exact pattern among adults. So yes, if you're fully vaccinated, there's a small chance you can get infected. It still remains less than 1% of all people fully vaccinated have in fact become infected. Your chances of becoming infected are just much greater if you're not vaccinated. So, none of this is perfect. We're living through a pandemic, and, unfortunately, there's no silver bullets at this point, particularly when there's high rates of community transmission, which is what we're still experiencing in LA County. But anything we can do to reduce risk in high risk settings is appropriate to do. And I don't think there's disagreement on the basic science here, that if you are fully vaccinated, you are less likely than unvaccinated people to become infected. And that's what this is based on. You're right. There's a risk that you take when you go into any situation where you're with other people and you're unmasked in particular, and you're close and you're crowded. But the risk for vaccinated people is far less than the risk for unvaccinated people. And in terms of enforcement, we've spent 20 months together as an LA community, really relying heavily on everybody understanding the reasons for the rules and abiding to the best of their ability to what they're being asked to do. And I want to give a lot of credit to our bars, our nightclubs, our lounges, our restaurants, our businesses, our large event venues, who have been with us on this journey for many, many months, with many different requirements placed on them, depending on what we were seeing in terms of transmission. So I have a lot of confidence that we will have high compliance with these requirements. As always, we will be sending out our health inspectors to provide technical assistance and support. And as with every other health officer order, folks who continue to violate the orders are subject to citations. But we've issued very few citations. So I think that really speaks to the level of cooperation. We're in this together. And frankly, at this point, everything we can do to avoid getting ourselves positioned for another disastrous surge in the winter, I think is something we're all going to unite behind. But thanks for that. We'll take the next question.
And that'll come from Marla Tellez with KTTV Fox LA.
Hello, doctors. Thank you so much for taking my questions. I have actually, in line with Joy's question, a couple of follow-ups. So the first one regarding breakthrough cases. Is it fair to compare, and do you have the data on flu vaccine breakthrough cases?
It's a great question, Marla, and thanks for that. I certainly don't have the data on me, but what I can tell you is that the COVID-19 vaccines to date have offered more protection against post-vaccination infections than the flu vaccines have. But we'd be happy to get you more information on that. I want to note that we have very good tracking systems in place for COVID. We don't have such great systems in place for tracking flu. So the numbers tend to be, a little less certain. But there's been both national data on that, and we have some experience across California, and I'm sure our team would be happy to get that to you.
Okay, great. And then my second question is about your forthcoming health order. Does that take effect tomorrow, or does it take effect officially October 7th when those shots need to be in those arms?
Yes.
And then also relating to the enforcement process, is there any training that's involved with helping these establishments? And are you concerned about the rise of fake vaccination cards and how to tell the difference?
Yeah, thanks so much. I mean, I definitely will talk
you.
more about this tomorrow, because I am doing a press briefing tomorrow. And we'll have our health officer orders done and our guidance done, so I can be more specific. But absolutely, in terms of the dates, we always try to issue orders ahead of time so people know what was expected, especially when we're asking people to make changes. So we'll issue something, we'll issue the orders tomorrow, we'll issue the guidance tomorrow, and then we'll work with businesses so that they're able to fully implement by, as you noted, the implementation date, which is October 7th. So, and we will, as always, spend the next few weeks providing technical assistance. We do visits where people ask us to, We hold briefings. We've already spoken with bars, nightclubs, and lounges. We're speaking with large event venues tomorrow. We do one-on-one calls with folks who request that because they have special circumstances that they need to run by us. And we're here to be helpful with all of the businesses that will need to come into compliance with this. And, you know, fake vaccination cards is an issue we've all discussed and we're well aware of. And our hope is that, you know, they don't proliferate. I think with every you know, requirement, there always are a very small group of people. And my hope is that it remains a very small group of people who try to circumvent the rules. In general, we get high compliance. In general, I think many people understand if you're going to these settings, you protect yourself and others if you're fully vaccinated. And when you violate that by, you know, falsifying documentation, you create a lot of risk that both for yourself, but also for other people. So our hope is that people don't do that. You know, get yourselves vaccinated if you want to go indoors, and otherwise, if you like to frequent bars, we have lots of bars that offer outdoor, you know, sites where you can feel free to still be there even if you're unvaccinated. So I'd urge people, you know, to play by the rules because the rules are there to protect each other. So, and thanks for that. We can go on to the next question.
Yep, and next we'll go to Claudia Pescido with KNX.
Hi, I have a couple of questions for Barbara and one for Maria. For Maria, do you have an update on other school districts that may be planning to implement or at least considering a student vaccination mandate? And for Barbara, the CDC put LA County back in the high transmission category today. I'm wondering if that's because of the backlog of cases that was reported after the system update this weekend. And this may be a dumb question, but a lot of people are asking, and I just want to confirm. When we talk about any vaccination requirements, they do not apply to children 11 and younger who are not eligible for vaccination. Is that correct? So basically, when these new rules go into effect, kids can still go to Dodger games with their parents. Okay, thanks.
Yeah, thanks so much. So, you know, yes, I mean, the calculations are weekly calculations, and 2 of the days that folks may have used were Saturday and Sunday when we weren't able to report because we were doing systems upgrades. We have, you know, we go back and assign those cases appropriately to as you know, the episode dates, but it's still increased, you know, the numbers for Saturday and Sunday. You can't really book a 0 for those 2 days. That wasn't accurate. You know, we saw on average what we've been seeing on average, which is close to 2,000 cases a day. And then in terms of vaccination requirements, you're absolutely right. At large event venues, similar to what happens indoors at those venues right now, children under 12 will need to go ahead and get a negative test. And we're working, you know, obviously there's very few bars, nightclubs, and lounges where children under 12 may be, but in those cases, they would, of course, be exempt from the vaccination requirement. And I'll turn it over to Dr. Poulin.
Thank you for that question. At this time, we only have the 2 districts identified, and we don't have information on any new districts moving forward.
Okay, thank you.
Next question comes from Howard Bloom with the LA Times, and he actually wrote it in. He said, are there any differences now between the state and county guidelines for quarantines in schools and youth settings? And if so, what are they?
Yeah, thanks so much for that question. The only difference is I'm not sure that what the state does in terms of language around outbreaks. You know, I want to note that local public health departments always have authority during an outbreak to look at the situation and ask for different restrictions based on what they're seeing. So whether it's in there or it's not in there, any local health jurisdiction that's investigating an outbreak can determine that they need to do some things differently than might be in state guidance or local guidance for that matter. But that's really the only difference. I think otherwise we're fully aligned.
Great, and that's all the questions that we have in queue for today.
Thank you so much, everyone. And yes, I will be doing a briefing tomorrow, you know, presenting the rest of our weekly updated data. but also I'll focus obviously on walking us all through the new health officer order, and we'll go ahead and be able to answer any additional questions on that tomorrow. I want to again thank Dr. Martinez Poulin for being with us today, and thank all of you for your great job getting information out to everybody. So thanks so much.
Great, thank you. And tomorrow's media briefing will be at 1:30. If you have any other questions that you have today, you can send that to media@ph.lacounty.gov, and we will get back to you over email. We will make remarks in Spanish, and we'll begin those in about 5 minutes. Monica, are you all set to begin?
Thank you, Kim.
Yep. You're all set.
I will start with the Doctora Martinez Pulin statement.
Okay.
And I will go to our statement. Thank you. A continuación les presentamos las palabras de la doctora Martínez Paulín de la Oficina de Educación de Los Ángeles. Buenas tardes a todos. Y damos un agradecimiento especial a nuestros amigos de los medios de comunicación por seguir brindándonos la oportunidad de conectarnos con la comunidad. Queremos tomarnos un momento para agradecer a la doctora Ferrer y al Departamento de Salud Pública por su colaboración. Se han comprometido a escuchar nuestros comentarios, compartir información y tomar decisiones basadas en datos. Gracias por escucharnos. El regreso a la instrucción presencial este otoño no ha sido sin dificultades, pero en educación hablamos mucho sobre una mentalidad de crecimiento y sobre los momentos en los que estamos llamados a modelar esa mentalidad para nuestros estudiantes. Una mentalidad de crecimiento abarca los desafíos y el proceso de mejoramiento. Sabemos que los educadores de todo el condado de Los Ángeles están afrontando este momento con valentía, perseverancia y con el compromiso continuo de mejorar. Nos gustaría tomarnos unos minutos hoy para compartir con padres algunas de las diferentes herramientas que los distritos de todo el condado están utilizando para implementar múltiples capas de protección para los estudiantes que asisten a clases en persona. Los planes para la reapertura en las escuelas son los siguientes. Chequeos diarios de síntomas y pruebas periódicas de COVID-19. Programación escalonada para limitar las reuniones y las oportunidades de exposición. Cuarentena y aislamiento para prevenir la propagación de COVID-19. Mascarillas, protectores faciales, independiente del estado de vacunación. Esto está requerido en interiores y muy recomendado al aire libre cuando no es posible el distanciamiento social. Almuerzo, escalonado por turnos al aire libre si es posible y lograr el mayor distanciamiento social posible. Las pruebas de COVID-19 en las escuelas. Los distritos continúan implementando y expandiendo los programas de pruebas. Hay fondos federales de los CDC disponibles para apoyar los programas de pruebas en los distritos escolares. Los padres pueden comunicarse con los directores de las escuelas para obtener más información sobre las oportunidades disponibles para que sus hijos participen en las pruebas regulares en la escuela. Estos programas de detección son fundamentales para detectar e identificar rápidamente casos dentro de las comunidades escolares. Estamos agradecidos con nuestras comunidades escolares en todo el condado por su incansable compromiso con la salud y la seguridad de los estudiantes. Hemos tenido la oportunidad de visitar escuelas en todo el condado para dar la bienvenida a los estudiantes a las clases presenciales este otoño. Los estudiantes están emocionados de estar de regreso en persona y lo más importante, de conectarse entre sí, lo cual es esencial para su salud mental. Sepan que los maestros y el personal de las escuelas se preocupan profundamente por sus hijos y están trabajando arduamente para apoyarlos en todo lo que puedan. Muchas gracias. Now I'm going to start with the presentation from the Department of Public Health. Gracias por acompañarnos hoy. Agradecemos a la doctora Martínez Paulín y a todo el equipo de la Oficina de Educación del Condado de Los Ángeles por su liderazgo excepcional durante estos tiempos tan desafiantes y por la oportunidad de trabajar en estrecha colaboración con todos los distritos para garantizar la seguridad en todas nuestras escuelas. Esta tarde presentaremos información sobre las tendencias de los casos pediátricos y las hospitalizaciones, datos sobre casos, brotes e investigaciones en las escuelas e información sobre cambios en la guía de cuarentena escolar. First slide, please. Comenzaremos con esta línea de tendencia que muestra las tendencias en las tasas de casos de COVID-19 por grupo de edad pediátrica desde el comienzo de la pandemia hasta ahora. Esta línea de tendencia muestra tasas de casos acumulados de 7 días en 3 grupos de edad diferentes. Y como puede ver, nuestras tasas de casos nunca aumentaron tanto como lo hicieron durante el aumento repentino del invierno. Y aunque las tasas de casos aumentaron entre los niños de todos los grupos de edad entre mediados de julio y mediados de agosto, desde entonces han disminuido en todos los grupos de edad. La tasa de casos actual para los jóvenes de 12 a 17 años es de 132 casos nuevos por cada 100.000 adolescentes. Para los niños de 5 a 11 años, la tasa de casos es ahora de 141 nuevos casos por cada 100.000 niños. Y para los niños de 0 a 4 años, la tasa de casos es de 88 por 100.000. Las tasas de casos en niños de 12 a 17 años, aquí representadas por la línea azul, continúan con los casos en niños de 5 a 11 años, aquí representados por la línea naranja. Los casos entre los niños más pequeños siguen siendo menores. Durante las últimas 3 semanas, los casos disminuyeron en todos los grupos de edad en un 40%. Estas disminuciones se registran con los datos que hemos visto para adultos y ocurrieron cuando muchas escuelas reabrieron con pruebas, uso de mascarilla, control de infecciones y protocolos de gestión de brotes. Dado que la mayoría de los 1,5 millones de niños de kinder a grado 12 ahora han regresado a la instrucción en persona, nos alienta a ver que las tasas de casos no hayan aumentado. Next slide, please. Las hospitalizaciones también reflejan la disminución de casos. Este gráfico muestra nuestras tasas de hospitalización entre los niños de 0 a 4 años representados por la línea verde, los niños de 5 a 11 años nuevamente representados por la línea naranja y los de 12 a 17 años nuevamente representados por la línea azul. Y aunque nuestras tasas de hospitalización pediátrica siguen siendo más altas ahora que en la primavera y principios de verano, están comenzando a disminuir y nunca se acercaron a las tasas que vimos durante el pico invernal. Si nuestras tasas de casos no aumentan, anticipamos una estabilización e incluso una pequeña disminución entre las hospitalizaciones pediátricas. Aunque estos datos no se muestran en este cuadro, no hemos tenido muertes pediátricas adicionales. Nuestras oraciones permanecen con las familias y amigos de los 7 niños que perdieron la vida a causa de COVID. Next slide, please. También podemos rastrear las tendencias de los casos por grupo de edad pediátrica y para los de 12 a 17 años por estado de vacunación. Entre los niños de este grupo de mayor edad, donde algunos están vacunados y otros no, la eficacia de las vacunas es evidente. La línea de puntos azules que representan la tasa de casos entre los jóvenes de 12 a 17 años no vacunados se eleva muy por encima de las tasas de los niños de este grupo de edad que están completamente vacunados. Y aquellos que están completamente vacunados también disfrutan de las tasas de casos que son más bajas que en cualquier otro grupo de edad. También puede ver que después de los aumentos en todos estos grupos, hemos visto que las tasas de casos disminuyeron en un 43% en todos los grupos de edad. La disminución en las tasas de casos entre los niños de edad escolar es particularmente prometedora, ya que se produce en un momento en que muchos estudiantes han regresado a la escuela. Tenemos la esperanza que con mucha atención a las estrategias escolares que reducen el riesgo de exposición, podamos seguir viendo bajas tasas en todos los grupos de edad. Next slide, please. Con un mayor conocimiento de la efectividad de las vacunas, nuestra máxima prioridad es aumentar las tasas de vacunación entre los adolescentes que están en los grupos aprobados y que no han sido vacunados. Al 12 de septiembre, el 63% de los adolescentes del condado de Los Ángeles de 12 a 15 años también habían recibido al menos una dosis de la vacuna y el 53% estaban completamente vacunados. Entre los adolescentes de 16 a 17 años, el 70% había recibido al menos una dosis y el 61% de este grupo de edad estaba completamente vacunado. La seguridad en las escuelas se amplifica Muchas veces cuando la cobertura de vacunación es muy alta y la vacunación generalizada reduciría drásticamente el contagio en otros entornos, incluso en actividades extracurriculares, eventos comunitarios y en el hogar. Agradecemos a todos los que están haciendo su parte para aumentar el número de cobertura de vacunación, los adolescentes que se vacunan y sus padres, las clínicas de vacunación que reciben a las familias en momentos y lugares convenientes, y el liderazgo de los distritos escolares que requieren vacunas para quienes están en los grupos aprobados para recibir la vacuna. Next slide, please. Estamos trabajando en estrecha colaboración con las escuelas para seguir el número de casos positivos y sus contactos cercanos, como se ve en esta tabla. Estos números reflejan el número total de casos nuevos y contactos cercanos reportados desde entornos escolares de kinder a grado 12 en todo el condado de Los Ángeles entre el 15 de agosto y el 13 de septiembre. Además de informar el número de casos y contactos por su estado como estudiante o personal, también informamos el porcentaje por cada categoría de los reportes de los completamente vacunados según los informes escolares. Pueden notar que algunos de estos números son bastante diferentes a los de la semana pasada. Estos cambios se deben a la modificación en el análisis de los datos de casos por fecha de episodio en lugar de por fecha de informe, lo que significa que ahora excluimos los casos identificados antes del 15 de agosto. Por lo tanto, los datos presentados aquí brindan una imagen más precisa de los nuevos casos durante este periodo. Si observa la columna bajo el título Casos, puede ver que se informaron un total de 7.995 casos de estudiantes y 1.193 casos de personal durante este periodo de 3 semanas. Y la mayoría de ambos grupos se presentó en el Distrito Unificado de Los Ángeles, que evalúa a todos semanalmente. Con más de 1,5 millones de estudiantes y 175,000 empleados en todo el condado, según los recuentos del año pasado, eso significa que el 0,5% de nuestro cuerpo estudiantil y el 0,7% de nuestro personal se han infectado desde que reabrieron los distritos escolares. Esto es un poco más alto que el índice de infección de 0,4% que experimentamos en general en el condado. Y dado que se hacen pruebas masivas a personas asintomáticas en las escuelas, esta tasa muy baja de infección confirma la seguridad que le brinda a los estudiantes y al personal de las escuelas. Cuando observamos a los contactos cercanos que si no están completamente vacunados están sujetos a cuarentena hasta 10 días después de la exposición a un caso, notará que se han reportado 15.655 contactos de estudiantes y 1.056 contactos de personal, con 22.650 contactos cercanos adicionales de origen desconocido, aunque se sospecha que la mayoría de ellos son de estudiantes. En total, casi el 2% de todo el personal y los estudiantes de todo el condado han sido identificados como contactos cercanos de un caso. Los datos hasta la fecha indican que muy pocos de los contactos cercanos identificados han resultado después en un caso positivo. Existen estrategias efectivas que pueden reducir la cantidad de estudiantes y personal que necesitan ponerse en cuarentena después de la exposición a un caso y brindamos asistencia a las escuelas con una gran cantidad de casos y contactos cercanos. Tenemos un centro de llamadas que cuenta con personal todos los días durante la semana, donde los administradores pueden llamar y obtener asistencia inmediata con la gestión de casos y la identificación de contactos cercanos. El personal del Departamento de Salud Pública también va a las escuelas que necesitan ayuda y cuando se identifica un brote, los equipos de salud pública brindan apoyo adicional para limitar el contagio continuo. También debemos tener en cuenta que la estrategia más eficaz para reducir las interrupciones de la cuarentena en las escuelas intermedias, secundarias y preparatoria es que todos los estudiantes y el personal de los grupos aprobados estén completamente vacunados si es posible. Next slide, please. También podemos ver la información sobre casos por el número de programas escolares que informan 1, 2 o 3 o más casos y rastrear cómo esto ha cambiado cada semana desde que se abrieron las escuelas. Tenga en cuenta que ahora estamos informando datos de casos por fecha de episodio en lugar de la fecha del informe para controlar las demoras en los informes. Desde el 16 de agosto, 1957 escuelas han informado al menos un caso a salud pública. Como puede ver en esta figura, los programas escolares que reportan un caso por semana aumentaron inicialmente de 467 durante la primera semana de clases a 562 durante la segunda semana de clases, pero han disminuido durante las 2 últimas semanas de monitoreo. Los sitios que informaron 2 casos se mantuvieron en un nivel durante las primeras 3 semanas de clases, pero observamos una disminución la semana pasada. Los sitios que informan 3 o más casos han ido disminuyendo desde la primera semana de clases. La disminución en el número de escuelas que informan 3 o más casos entre las 2 últimas semanas de seguimiento es del 76%. Cada caso identificado en una escuela debe aislarse en el hogar, lejos de los demás durante un mínimo de 10 días desde el inicio de los síntomas o la fecha de la prueba. Se identifica a sus contactos cercanos y si no están vacunados, se les exige que se pongan en cuarentena. Next slide, please. Si bien los casos entre los estudiantes y el personal están disminuyendo, la mayoría de nuestros casos en entornos escolares se dan entre personas que no están completamente vacunadas, como puede ver en esta tabla, aunque la proporción de casos entre las personas que están completamente vacunadas aumenta con la edad de las personas infectadas. Entre el 15 de agosto y el 14 de septiembre, el 5% de los casos entre los adolescentes de 12 a 14 años fueron adolescentes completamente vacunados y el 11% de los casos entre los adolescentes de 15 a 18 años se encontraban entre los que estaban completamente vacunados en ese grupo de edad. Al mismo tiempo, del 22 al 24% de los casos de entre 19 y 39 años estaban completamente vacunados, mientras que el 35% de los casos entre el personal de 60 años o más estaban completamente vacunados. El mayor porcentaje de casos entre adultos completamente vacunados puede deberse a un número mucho mayor de personas en estos grupos de edad que están vacunadas, particularmente con el mandato de vacunación para el personal escolar. Tenga en cuenta que nuevamente, que debido a que el Distrito Escolar Unificado de Los Ángeles no informa sobre el estado de vacunación entre sus casos, los datos que tenemos aquí son todos de distritos que no pertenecen al Distrito Escolar Unificado de Los Ángeles. Next slide, please. Continuamos rastreando brotes en escuelas del Condado de Los Ángeles y programas afiliados a las escuelas, incluidos los deportes juveniles. Un brote es cuando ocurren 3 o más casos con probable contagio en las escuelas o actividades escolares. Como señalamos antes, en la mayoría de los casos en las escuelas donde hay más de 3 casos, los casos no están vinculados entre sí y por lo tanto no se cuentan como un brote. Vimos 6 brotes durante la semana del 29 de agosto y 8 brotes la semana pasada. Aunque los deportes juveniles representados aquí por los bloques en naranja fueron la principal fuente de los brotes entre los niños de kinder a grado 12 durante el verano y han seguido siendo una fuente persistente, la mayoría de los brotes ahora se están produciendo en las escuelas primarias representadas aquí por los bloques en azul claro. Si bien la pequeña cantidad de brotes confirmados es muy baja y una señal positiva de que los esfuerzos de mitigación pueden ser muy efectivos para reducir la propagación, anticipamos que continuaremos viendo una tendencia ascendente en los brotes a medida que se abran más escuelas. Salud Pública continuará trabajando con las escuelas para prevenirlos, investigarlos y manejarlos a medida que sucedan. Next slide, please. En este cuadro puede ver la cantidad de casos y contactos involucrados en los brotes descritos en la diapositiva anterior. Tenga en cuenta que estos números son diferentes a los de la diapositiva anterior, perdón, y muestran todos los casos y contactos de kinder a grado 12 porque el número de casos vinculados epidemiológicamente como parte de un brote es un pequeño subconjunto del número total de casos que identificamos cada semana. El número de brotes que ocurren en las escuelas sigue siendo inusualmente bajo. Como se señaló anteriormente, pasamos de 6 a 8 brotes entre la semana del 29 de agosto y la semana del 5 de septiembre, y un aumento del 33%. Mientras tanto, el número de casos involucrados en brotes aumentó en aproximadamente un 50% durante el mismo lapso, mientras que el número de contactos aumentó en más del 70%. Esto sugiere que las escuelas y los deportes juveniles identificaron la semana pasada contactos más cercanos para los casos en comparación con la semana anterior. El manejo apropiado de los brotes es importante para evitar una propagación generalizada en las escuelas, y los investigadores de brotes del Departamento de Salud Pública ayudan con esta tarea en todas las escuelas que tienen un brote. Next slide, please. Como parte de los esfuerzos de mitigación en las 31 escuelas que han experimentado un brote, hemos identificado prácticas riesgosas que a menudo se asocian con brotes en una variedad de entornos. En esta diapositiva se incluyen algunas prácticas más comunes identificadas al investigar brotes en las escuelas de kinder a grado 12 y junto a ellas algunas de las alternativas más seguras que recomendamos. El uso inconsistente e incorrecto de mascarillas en interiores es una característica común de los brotes. El uso de mascarillas de manera correcta y constante en interiores y cuando está en contacto cercano con otras personas al aire libre ayuda a reducir el riesgo de brotes. El hacinamiento fuera de las aulas también está relacionado con el contagio, mientras que el distanciamiento físico en los momentos en que se deben quitar las mascarillas, por ejemplo, al comer o beber, hace que la propagación sea menos probable. La disposición de los escritorios en módulos facilita la propagación al colocar a los estudiantes frente a frente, mientras que organizar todos los escritorios hacia la misma dirección evita que los estudiantes estén frente a frente y así se reduce el riesgo de transmisión. Ha habido un par de brotes que se han asociado con el permitir que las personas sintomáticas ingresen al sitio, pero esto aumenta la probabilidad de propagar la infección, mientras que excluir a las personas sintomáticas de la escuela detiene la cadena de propagación. Next slide, please. Esta diapositiva verá una lista similar, pero para prácticas asociadas con brotes en deportes juveniles. El uso inconsistente e incorrecto de mascarillas durante las prácticas y los juegos es una característica común de los brotes en los entornos deportivos juveniles. Ayuda a reducir el riesgo de brotes el uso constante y correcto de las mascarillas, teniendo en cuenta la categoría de riesgo del deporte, así como si se juega en interiores o al aire libre, o cuando se está al aire libre y en contacto cercano a otras personas. No excluir a las personas sintomáticas y los contactos cercanos de las actividades del equipo deportivo, incluidos los que están fuera del campo de juego, se asocia con brotes, lo que destaca la importancia de excluir a las personas sintomáticas y los contactos cercanos para detener la propagación. Cuando los equipos se han mezclado en las salas de levantamiento de pesas, ha habido contagio entre los equipos. En su lugar, recomendamos mantener los turnos en estas salas para diferentes equipos. Por ejemplo, evitar tener tanto a los equipos de primera y segunda división que estén en las mismas salas al mismo tiempo. La mezcla y el hacinamiento en los vestuarios también se asocia con los brotes de los equipos, los cuales pueden evitarse escalonando el uso de vestuarios para evitar el hacinamiento y promover el distanciamiento. Next slide, please. Después de revisar 4 semanas de datos relacionados con casos, contactos cercanos y brotes en las escuelas, muchos de los cuales acabamos de compartir, nos sentimos cómodos con que ante un contagio relativamente bajo en las escuelas, resulta apropiado ofrecer a las escuelas una opción de cuarentena modificada para estudiantes de kinder a grado 12 expuestos a COVID en la escuela bajo ciertas circunstancias. Las escuelas y los distritos escolares no están obligados a ofrecer una opción modificada y pueden optar por continuar con los requisitos de cuarentena habituales. Como recordatorio, las personas asintomáticas completamente vacunadas no están obligadas a ponerse en cuarentena. Estos estudiantes deben vigilar los signos y síntomas de enfermedad durante 14 días después de su última exposición. La cuarentena modificada permite, bajo ciertas circunstancias, que un estudiante expuesto no vacunado con exposición a un caso confirmado de COVID-19 continúe la instrucción en persona en la escuela durante su cuarentena, pero restringiendo sus actividades fuera del aula. Aquellos que califican para una cuarentena modificada incluyen contactos cercanos cuya exposición tuvo lugar en la escuela o una actividad supervisada por la escuela. Tanto el contacto como el caso estaban usando mascarilla durante todo el periodo de exposición y los contactos cercanos no son parte de un brote definido. Para aplicar una cuarentena modificada se debe cumplir con varios criterios. Primero, el estudiante expuesto debe permanecer asintomático durante la cuarentena. También debe quedarse en casa, excepto para actividades de instrucción educativas y en el salón de clases, y deben continuar usando una mascarilla en interiores, al aire libre y en el autobús escolar, excepto cuando están comiendo o bebiendo. Mientras comen y beben, deben mantenerse al menos a una distancia de 6 pies de los demás. Idealmente, se debería comer o beber al aire libre. Los estudiantes en cuarentena modificada también deben someterse a las pruebas 2 veces por semana durante su cuarentena. La primera prueba debe realizarse el día primero y segundo después de la exposición, mientras que la segunda prueba debe realizarse 5 días después de la exposición. La cuarentena modificada finaliza cuando una segunda prueba realizada al menos 5 días después de la exposición es negativa. En este escenario, el estudiante expuesto puede finalizar la cuarentena modificada después del día 7. Next slide, please. Agradecemos a todos los que trabajan tan duro para garantizar la seguridad de los estudiantes, el personal y las familias en las escuelas y aplaudimos los esfuerzos realizados hasta la fecha para reducir las exposiciones. Somos conscientes de que la vacuna es la protección más poderosa contra la propagación y apoyamos los mandatos de vacunación selectiva. Con más de un distrito escolar que ahora exige la vacunación entre los niños de 12 años o más, queremos terminar señalando los beneficios de vacunar a los adolescentes que están en los grupos aprobados para recibir la vacuna. Aunque las personas vacunadas pueden contagiar la variante Delta, es probable que contagien menos que las personas no vacunadas. Y como vimos anteriormente, tienen aproximadamente 8 veces menos probabilidades de infectarse. Entonces, si bien vacunar a los adolescentes protege a los adolescentes mismos, también protege a los amigos y familiares con quienes comparten gran parte del tiempo fuera de la escuela. Vacunar a los adolescentes también tiene la ventaja de proteger a los niños más pequeños en la escuela con quienes entran en contacto y que no pueden ser vacunados. Y debido a que vacunar a los adolescentes también reduce la propagación en la escuela, disminuye la probabilidad de que los brotes causen interrupciones en el aprendizaje. Una de las principales ventajas de estar vacunados es que es más probable que los estudiantes completamente vacunados permanezcan en la escuela después de una exposición. Esto se debe a que nuestra guía de cuarentena actualmente exime de la cuarentena a las personas asintomáticas completamente vacunadas. Junto con nuestros aliados escolares, estamos trabajando arduamente para asegurarnos de que sea fácil para los adolescentes vacunarse. Puede buscar sitios que vacunen a adolescentes cerca de usted en nuestro sitio de internet vacunatelosangeles.com. Muchas gracias y hasta la próxima.